Disclaimer: the information provided by Robin's Nest Neuro Alliance on this YouTube channel is intended for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare professional with any questions you may have regarding a medical condition. Breacher's syndrome is not a formally recognized medical or neurological condition, but the term is sometimes used informally to describe the effects of repeated blast exposure on law enforcement and military personnel involved in breaching operations. These individuals are routinely exposed to blast overpressure waves from explosive charges used to gain entry into buildings, which can lead to both acute and chronic health effects. Key features of Breacher's syndrome, based on blast exposure research. 1. Mild traumatic brain injury, or mTBI. Exposure to low-level blast waves can cause subtle brain injuries, even without direct impact. Symptoms may include headaches, confusion, memory issues, and slowed cognitive processing. 2. Vestibular or balance dysfunction. Damage to the inner ear due to blast waves can cause dizziness, vertigo, and difficulty maintaining balance. Tinnitus, or ringing in the ears, is also common. 3. Neuropsychiatric effects. There is an increased risk of anxiety, depression, PTSD-like symptoms, irritability, and sleep disturbances. Some breachers report emotional instability and difficulty concentrating, similar to blast-induced neurotrauma seen in military veterans. 4. Chronic traumatic encephalopathy, or CTE risk. Repeated exposure to subconcussive blasts may contribute to neurodegenerative changes over time. This is similar to findings in NFL players and military personnel with chronic blast exposure. 5. Autonomic nervous system dysregulation. Some research suggests breachers may experience abnormal heart rates, blood pressure fluctuations, and chronic fatigue, possibly due to blast effects on the brainstem. How does this relate to SWAT officers? SWAT breachers face similar blast exposure risks as military personnel, though usually at lower intensity. However, repeated exposures over time can accumulate and lead to long-term neurological and cognitive effects. Mitigation strategies. Wearing proper protective gear such as helmets, ear protection, and blast shields. Reducing exposure frequency or increasing standoff distance from blasts. Routine neurocognitive and vestibular screenings for early detection. Training modifications to limit unnecessary blast exposure. U.S. military special operators. U.S. Army, U.S. Navy, Air Force, U.S. Marine Corps, Coast Guard. Yes, Special Operations Forces personnel, including Navy SEALs. Army Special Forces, Delta Force Rangers, MARSOC, and other elite units can suffer from Breacher's syndrome or blast-induced neurotrauma due to repeated exposure to explosive breaching heavy weapons fire and blast overpressure from training and combat operations. Why are Special Operations Forces at high risk? First, frequent exposure to explosives. SOF personnel conduct dynamic entry operations using explosive charges to breach doors, walls, and bunkers. Many missions involve repeated blast exposures over a career, compounding potential neurological effects. Second, blast overpressure from weapons, firing heavy caliber weapons. Rocket launchers like the Carl Gustaf, AT-4, and Javelin, and breaching charges exposes operators to concussive forces. Repeated subconcussive exposures can accumulate and cause lasting brain changes. Third, high operational tempo and training cycles. Unlike conventional forces, SOF units deploy frequently and for extended periods, increasing total blast exposure. Realistic training involves live explosives, which adds to cumulative brain trauma. How does Breacher's syndrome affect SOF operators? The effects are similar to those seen in SWAT teams and military breaches, but SOF may have a higher frequency and intensity of exposure, increasing risk. Neurological and cognitive symptoms include memory issues, slowed thinking, and difficulty focusing, often referred to as brain fog. Headaches and migraines are common. Sleep disturbances and chronic fatigue also occur. There's an increased risk of chronic traumatic encephalopathy, or CTE. Vestibular and sensory effects include dizziness, vertigo, and balance problems. Tinnitus, which is ringing in the ears, and hearing loss are also common. Vision problems like light sensitivity, blurry vision, and tracking issues can occur. Psychological and emotional impacts include irritability, mood swings, and anxiety. Depression and PTSD-like symptoms are also prevalent. Impulse control issues, similar to those seen in NFL players with repeated head trauma, can develop. Evidence from military studies shows that repeated blast exposure correlates with structural brain changes, cognitive decline, and increased risk for neurodegenerative diseases like CTE and Alzheimer's-like conditions. Recent research, including studies on US Special Operations Forces, Army Rangers, and Navy SEALs, supports this. One study on Navy SEALs showed that many operators experience symptoms of blast-induced mild TBI without ever being formally diagnosed. This is because symptoms can be subtle at first and mistaken for stress or sleep deprivation. Final thoughts. Yes, Navy SEALs, Army Special Forces, and other SOF personnel can absolutely suffer from breaches syndrome due to repeated blast exposure over years of service. Studies suggest long-term neurological consequences are real, and efforts to mitigate these risks are critical for preserving operators' health post-service. SWAT officers, particularly breachers, face repeated blast exposure that can lead to long-term neurological, cognitive, and vestibular issues. While exposure is an inherent part of the job, risk mitigation strategies can help reduce the impact of breaches syndrome and other blast-related injuries.